Hi, welcome to another episode of Sex Ed with Mel in 30 minutes or less here in Jefferson County in Colorado. So this episode is a little bit different because today we're going to be talking with parents and other people who are trusted adults of young persons. How do you talk to your young person about sex? It's a common question and a common concern, but we're here to help you out with some pointers no matter how old your kids are. So before you get started, maybe you want to know some reasons why you might want to talk to your kids or your teen or a young adult in your life about sex. Well, the first one is a pretty good reason here, is the statistics of how and when young people become sexually active. Overall, about half of all teens will have sex at least one time by the time they graduate high school. And by the time that they're 19, over 70% will have had sex at least once. And so wouldn't you rather they had the information before they need it? Studies also show that teens who have a good relationship with their parents, where they've had those conversations about sex and choices relating to sex, oftentimes start having sex much later than teens who do not. And when they do start having sex, they're much more likely to use condoms and birth control to protect themselves and have fewer partners and take less risks. Before we get into the nitty-gritty of the how and the why and the what of how to talk with your kids or young teens about sex and sexual choices, here's some general tips to keep in mind. The first one is that it's always a good idea to start early with age-appropriate and medically accurate information. If you haven't started yet, don't worry, it's never too late to begin. The second thing to keep in mind is that it's okay to feel uncomfortable, and it's okay for your kids to be uncomfortable. Sex can be a sticky topic, and just by acknowledging that maybe you aren't sure all the time of what to say, or you don't expect them to have all the answers either, can help ease the conversation. Another thing is that there are many ways to start the conversation using what we call teachable moments. Find things in the TV stations you watch, or movies, or popular media, or stories that your children tell you, or stories from your youth, to use examples of what are good choices and what aren't, and ways to introduce those topics in. The last thing is to remember that parents and other trusted adults really do make a difference in young person's choices about their sex and sexuality. If you're able to have those conversations, just keep those things in mind. Fewer partners, later onset, healthier choices. Before you get started to have a conversation with your child, here are some things to keep in mind as prep work, homework for you before you get started. The first one is to build a broad information base of accurate knowledge from good sources. Remember that talking about sex and choices about sex go far more than just gender and sex and intercourse and biology and reproduction. There's a whole other gamut of things that you as a parent will want to talk to your child about. Things like intimacy, love, what's a healthy relationship, what isn't a healthy relationship, and ways to tell the difference between all those things. The second thing to keep in mind is that you should learn to use medically accurate terms for body parts and body functions. It might seem uncomfortable at first to teach your child medically accurate terminology, but it helps to clarify later when you're talking about more than just the basics. So if you have a hard time saying penis or vulva without making a funny face, practice by yourself in the mirror until you can say it as easily as you can say hand or elbow. Step 3 is to make sure that you clarify your feelings and values about sex and love before you talk to them about your children. It's hard to pass on your family's values and what your expectations and hopes are for them if you don't know what they are before you start. Finally, here are some things to keep in mind while you are having those conversations. The first one is timing. Be open and available to talk with your children when they are ready to do so. Oftentimes you might find a teachable moment together, but it may be that your child asks you a spontaneous question and you should be ready and prepared to answer it. And if you are open and available when they need you, they're more likely to come to you again later. The second thing to remember is that, again, it's okay to be embarrassed. Just acknowledge it, use it as a funny moment, and move past it. The third one is to remember to talk with your child and not just at them. If you're able to keep a two-way conversation going instead of just lecturing, you'll get better results that way. And then finally, remember that you are their parent and not their peer. It is your job right now to express your hopes and worries for them, but also your values, your feelings, and what you think about the topics you're talking about. So here are some general tips about answering questions that you can use with any age group. No matter whether your child is a preschooler or a teen, you can use these same guidelines to answer their questions about sex or sexuality. First, clarify what they're actually asking. Sometimes you might not understand what they're trying to know, or they may not have the words to really ask you what it is they're curious about. So if you're not sure, check with them first before you give the answer. Next, when you're actually answering, make sure you don't give them too much information. Make sure your answers are clear and precise. Give definitions to new terms or new words that they may not have been exposed to before. And always, give them the opportunity to ask more questions about that particular topic. Maybe when you're done answering, say, is there anything else you'd like to know about this topic that they've asked about? Third, make sure you check understanding. It's not enough just to give the information in your answer. You have to be sure that they understand it so that they can apply the information you've given them when they're making choices later. And finally, it's okay not to have all the answers right now. If they ask you a question that you don't know the answer to, or maybe you're not sure how to answer yet, it's okay to say, I don't know the answer to that right now, but I will find out and I will answer it for you as soon as I have the information. Or, even better, find out more about the information and learn about it together. So now we'll get into the nitty-gritty of actually talking with your child about sex and choices related to sex. So with our first group, our preschoolers and elementary schoolers, there are some general things that you should keep in mind. You should remember that, one, if they are old enough to ask about a topic, then they are old enough to receive the correct answer and learn the correct words for things. Two, sometimes they don't have the vocabulary to ask you what it is they actually want to know about, so make sure you check and verify what it is they actually want to know before you give the answer. Three is timing. Answer the question when they ask it, if at all possible. If you're not able to discuss whatever the topic is in the given moment, then you can say, I'm really glad you asked me about that, and we'll talk about it on our ride home today. Number four, remember that it is okay, and in fact, you should set limits and boundaries with this group starting as they are young. So if they ask you questions, you can, of course, decline to answer about your personal life. You can say, for example, what happens between your father and I is private, and I don't talk about it with anybody. And it's also important for you to clarify the difference between values and standards, and to acknowledge that those might be different between what your family holds and what other adults may think. So values are what you feel about a given topic, and standards are what you expect to be done with regards to that particular topic. For example, if your preschooler asks you, is it okay for me to look at my private parts? The answer to clarify values would be, yes, it's okay to look at your private parts, but the standard is that we only look at them when we are in private, when there's nobody else around. So something like that, you've clarified what you feel about it and how you expect the behavior to be. Here are some examples of questions and answers that are appropriate to questions that a preschooler might ask. The first one is, what is that? And then they point out a body part. And you might answer, that is a breast. Women have breasts and men do not. What else do you want to know about breasts? A second question that a preschooler might ask is, why do I have a penis and you don't? And an age-appropriate answer might be, girls have vulvas and boys have penises. Mommy is a woman, a grown-up girl, so mommy has a vulva and not a penis. You're a boy, so you have a penis and not a vulva. Do you have anything else you want to know about this? Elementary schoolers tend to ask questions that are a little bit more complex than the very simple ones that a preschooler may ask. One question that an elementary schooler may ask is, do boys get periods? And an age-appropriate response would be, no. Boys do not get periods, only women do. What about periods do you want to know? This leaves the door open for further conversation if he is curious about more things than just that. Here are some ways to respond to questions that teens may ask you. First question, what is the best method of birth control? And the answer is that there are different types of birth control are the best for different kinds of people. That's why it's important to be informed and knowledgeable about all the methods that are available before you choose to start using one. Are you thinking that you may need to start on a method? And finally, should two people who are in love have sex? The answer? Not necessarily. Sex is just one part of a whole relationship and is only one way of expressing love between two people. The decision to be in a sexual relationship is a big one, and there's a lot of things that you have to think about before you make that choice. Two people can love each other very much without necessarily having sex. Do you think you might be in love? So today we've given you some basic guidelines about how to talk with the kids and the teens in your life about sex and the choices related to sex. Remember that these are by no means the only things you should think about, but it provides you a good baseline at least to get started from. If you need more information or resources about talking with your teens or children about sex and the choices related to sex, you can send a text to the Go Ask Tish text line at Jefferson County Public Health. You can visit the Before Play website for conversation starters and tips and tricks. You can visit the Center for Disease Control website for accurate and factual information about sex and sexually transmitted infections and other health-related information. And you can also contact your healthcare provider. Of course, the Jefferson County Public Health Clinic are also happy to help you with these conversations with your youth. That's it, and we'll see you on the other side.